Thank you very much. Good afternoon to the committee. My name is John Mulka. I'm the Chief Executive of Blind Low Vision NZ, and I'm also the Chair of the Health Aotearoa Trust. I'd also like to acknowledge and welcome my colleague, Chrissie Cowan, who is the Chief Executive of Health Aotearoa and a fellow trustee of Health Aotearoa. Thank you for the opportunity to speak with you today about why New Zealand needs a national eye health survey. To begin, I think it's important that I tell you a little bit about who we are at Health Aotearoa, the Trust. It's New Zealand's peak body for eye health and vision care, and the member organizations are as follows: Blind Low Vision NZ, Glaucoma NZ, Kapolmari Aotearoa, Macular Degeneration New Zealand, the New Zealand Association of Optometrists, Sight Support Trust, the University of Auckland School of Optometry and Vision Science, the Royal Australian New Zealand College of Ophthalmologists, and last and certainly not least, the Visual Impairment Charitable Trust, Aotearoa, New Zealand. I want to begin by responding to the Chief Medical Officer's advice to the committee about the need for a national eye health survey. Our trust wants everyone living in New Zealand to have good eye health. Good eye health supports overall health and well-being. Currently, vision loss in this country costs New Zealanders $3.74 billion each year. The Chief Medical Officer had advised the committee that a national eye health survey is not necessary for two specific reasons. Number one, he cited in August 2022, the University of Auckland received $1.2 million in funding for the first population eye health survey in New Zealand. And the second reason was the Ministry of Health had already fund the New Zealand Health Survey. The 2024-25 Health Survey was suggested could include a module about eye health in the long-term conditions section. Next, I want to outline why Health Aotearoa doesn't agree with the advice provided by the Chief Medical Officer. Number one, the University of Auckland study that I spoke to, how we can improve eye, hearing, and feet health for older adults, is not a national eye health survey. It's essential that we understand how many people there are in New Zealand with a potential blinding disease. These diseases need to be carefully monitored and treatment started as soon as possible. Early treatment has been shown to limit vision loss for most eye diseases. The university study that I referred to only covers geographic areas that have been selected because of their high Maori and Pacifica populations. These specific areas do not reflect the national population. This study aims to understand the prevalence of diabetes and diabetic retinopathy and the associated issues such as frequency of eye exams and referral processes. The university study looks at the prevalence of vision loss, not the prevalence of underlying eye diseases. And we know that many eye diseases may be present without people experiencing vision loss or other symptoms. As an example, around 50% of people with glaucoma are unaware of it until they've been diagnosed with it. The second reason why around the need for a national eye health survey that the Chief Medical Officer cited was including an eye health module in the 2024-2025 New Zealand Health Survey will not produce the same level of detail and data as a national eye health survey. It's essential that the National Eye Health Survey includes a physical eye examination. The New Zealand Health Survey cannot determine the prevalence of eye disease. Many people with an eye disease are not aware of it. They have a disease or what their disease is called, and they may not respond appropriately in a simple survey. Only a comprehensive eye exam can detect underlying eye diseases and allow for early treatment to prevent or control vision loss. All the results of the New Zealand Health Survey are self-reported and subject to error. Typically, the number of people with sight loss is determined by asking people if they can read a newspaper from a certain distance with their glasses or contact lenses on. The only way to determine the real level of vision loss is with a physical eye examination. The New Zealand Health Survey is unlikely to yield accurate information. Full planning for eye health requires an understanding of what other conditions a person may have in addition to their eye disease. Other countries have conducted a national eye health survey and used the findings to inform their national eye health plans. The New Zealand Health Survey will not yield sufficient data to make this possible. I'll give you one quick example of how this can be done. And this was done in Australia in 2016 in their National Eye Health Survey, and they're getting ready to conduct their second ever National Eye Health Survey in that country. The first survey in 2016 was funded by a public-private partnership at a cost of 4 million Australian dollars. The Australian government contributed 1.8 million alongside financial and in-kind contributions provided by partner organizations in the eye health and vision care sector. A private-public partnership could be explored for New Zealand. It was a unique design involving 30 sites around Australia. There were 3,000 participants who were non-Indigenous, aged 50 years and older, and 1,600 participants who were Indigenous, aged 40 plus years. The survey included conducting a physical eye exam on each participant, as self-reported data is unreliable. It was reported that half the participants were unaware that they had an eye condition that could lead to blindness before the survey. I stress, if we are serious about eliminating preventable blindness and vision impairment in New Zealand, then we must have information for the whole New Zealand population. I'm now going to hand over to my colleague, Chrissie Cowan. Chrissie?
Thank you, John. Talufalawa ki orana I orana tēnā tātou katoa. It's a pleasure to meet you all and to convey the voices of tangata kāpō Māori and their whānau and my fellow Health Aotearoa Trust members. Kāpō Māori is the oldest national Indigenous DPO in Aotearoa, New Zealand. We all are also the only national tangata kāpō Māori and their whānau society in Aotearoa. It's in fact our 40th anniversary this year. It feels like a logical next step to be speaking to you all today about the imperative of a national eye health survey in Aotearoa, specifically the importance and benefits to Māori eye health. Just last week, I had the privilege of speaking at the 2023 National Aboriginal and Torres Straits Islander Eye Health Conference in Parramatta, Sydney, about the Kāpō Māori Aotearoa Declaration on Engagement and Exchange. The declaration is a culmination of data collated from 5 wānanga with tangata kāpō Māori and their whānau and tangata kāpō parents during 2021-22. We hope the declaration can be a stepping stone towards more respect and equality, positive change in healthcare for tangata kāpō Māori and Māori katoa in Aotearoa. It was exciting to hear other Indigenous groups talk about the 2016 survey in Australia and how the data had greatly supported improvements in Aboriginal and Torres Straits Islander eye health. For myself, I felt very sad and whakamā for our people in Aotearoa because we don't have that here. Also in 21, KMA signed a tātou pounamu with the Royal Australian New Zealand College of Ophthalmologists and have worked in partnership with the Ransko Māori and Pacifica Health Committee to draft the Ransko Te Tiriti Action Plan, which was launched in May this year. This plan affirms support for a national eye health survey for New Zealand. Very quickly, next month on the 19th of June, tangata kāpō Māori and Kāpō Māori Aotearoa will be presenting evidence for the Y2109 claim. This claim is part of the Y2575 Health Services and Outcomes Kaupapa Inquiry. It has emerged already that there is minimal to nil Māori eye health statistics. For that reason, Y2109 claimants, including Kāpō Māori Aotearoa, are seeking a national eye health survey as a remedy. Inequity of Māori eye health in Aotearoa has been entrenched through colonisations, the ramifications of which have passed on to current generations. Colonisation is often considered to be a historical event rather than an ongoing process that is negatively affecting the health of Indigenous people. It's already well documented that Māori have been politically, economically and socially undermined, leading to low income and life expectancy, poor education and health outcomes, and stigmatisation within health care, among other consequences. We often experience slower pathways through health care and are less likely to visit an ophthalmologist or optometrist than non-Māori. We need a national eye health survey to ensure we have accurate information to better plan for Māori eye health services. This should be supplemented by ongoing clearly defined data collection within each of the regions to facilitate ongoing service delivery. In the absence of a national eye health survey, we do not have accurate data on the prevalence of uncorrected refractive error in Aotearoa, New Zealand. There is a lack of data in New Zealand regarding the prevalence of common vision problems. We don't know where the areas of greatest need are in this country, and therefore where the resources need to be. By collecting data via an eye health survey, we could significantly lift our performance compared to other developed countries. For these reasons, as I shared already, Kapu Māori Aotearoa strongly believes a national eye health survey is a positive step forward, should be given priority and be fully funded by government. Ka tītaka kōrero, ngā mihi ki a koutou. Thank you, John.
Thank you.
Thank you. Well, thank you both for a very compelling submission and rebuttal, which was very useful to us. Thank you. Honourable Porter Williams has a question.
Kia ora, thank you, John. And kia ora ana, Chrissie, lovely to have you join us today with your submissions, and thank you very much for that. I've got one question with three parts that relates to the Australian survey that was conducted in 2016. So of that 4,600 odd that folk that were tested, do you know the percentage of those where issues were identified that weren't known before? So what was the impact of that survey in terms of identifying issues? How can we support the survey being in New Zealand? How can we determine the numbers that we need to give us a fairly accurate picture of what eye health would be like in Aotearoa? And how many people would you be considering would need to be part of that survey here to do justice to what you describe as needing to have, we've got no data at all. What would give us the best opportunity to get some good base data underway?
I will start. First off, the first part of the question was around the 2016 survey in Australia, and I believe why the numbers that were chosen and what was the success rate, or I don't have the exact percentage in front of me, but it was a very high incidence of people that were unaware of their vision loss. I want to say 80+% of the sample groups that were put together. Also, the factor that Chrissie also touched on is the early incidence in the Indigenous population. So hence why the difference in the age groups. There was a quadrant that were 50+, and then when testing the Indigenous groups in Australia, they went to 40+ because of the early onset of the diseases. So that was the first part. The second part is we do a similar sample size here in New Zealand, obviously to understand trends. We're looking at also regionalization in the country. What's the causation of these and the prevalence of eye diseases, and is it dictated by geography in certain parts of the country? Obviously, we believe that it's ethnicity. It's also demographics and a number of issues that combine to it. Chrissie, do you have anything else to add to that?
Yeah, it's my understanding that it was a 50% of the sample that they used. I can say, and this came out during the conference I was at Parramatta last week, is that the instances of one eye condition dominant over there called trachoma, which is a preventable eye condition. It came out the prevalence of trachoma amongst Aboriginal and Torres Straits people reduced over by between 50%, between 50 to 60% as a result of having the eye health survey.
That's awesome. Thank you.
We've run out of time, I'm sorry, but you've given us such a comprehensive submission that I think it's given us plenty of material to consider as we move forward with your petition. So thank you both. And John, can I just say that the screen you have behind you, Chrissie, you're elegant in your with the photo behind you, but I'm afraid, John, you take the prize because you've got this lovely branding, which looks great. So look, thank you both for your submission. You clearly have a depth of knowledge which you have then put onto paper for us, and that is going to be most helpful when we come to write and consider and write our report. So thank you both very much for your time today.
Thank you. And I also just want to acknowledge Sarah very, very quickly for her volunteer work on behalf of our guide dog program. So thank you, Sarah.
Oh, it's a complete joy, seriously, for everybody, actually.
Absolutely.
Yeah. And sorry about the crunching in the background. He's got a nylabone.
Thank you so much, both of you. Thank you. Okay.